we're in a situation where most employees have no idea how much their actual insurance costs. Most employees also don't understand that from the company's perspective, the benefits that they get in the form of health insurance are part of their compensation. So we've had this situation over the past 10 or even 20 years where healthcare costs keep rising and insurance premiums are rising faster than inflation, faster than wage growth, and so most people's wages have been somewhat stagnant over the last decade because all of the costs increase have been going into their benefits, mostly in the form of insurance premiums. And unfortunately, because of the insurance coverage which pays most of the bill, the individual patients, your employees, really have no idea how much their health care actually costs at the point of actually consuming that health care. And if you ask them how much a doctor's visit costs, they'll probably say, well, it's $30, right? That's their copay. So we have this situation where many people end up consuming health care as if it were free. Common, preventable, chronic conditions account for about 75% of our healthcare spending. That is what's behind the actual increase in our spending at such rapid rates. And when we look behind the scenes and understand what these chronic conditions are, we find out that most of them are preventable and most of them are associated with lifestyle choices. What's amazing is that people who don't smoke, lose weight, get exercise, and stick to a good diet have an almost 80% lower risk of developing chronic diseases. We don't do as well as many other countries at encouraging healthier lifestyles and preventing chronic conditions from happening. Once we are sick, we're very good at taking care of people and treating them for those conditions. What we don't seem to be as good at is preventing those conditions from starting in the first place. What we are doing is not working. We are not making a difference through the benefits that we are providing to our employees that is reducing those costs and attacking some of those root causes of these preventable conditions. And so healthcare spending and costs continue to rise 3 to 4 times inflation every year. Only 55% of the time do we actually get care that's recommended. So the other 45% of the time we're either getting more care than is recommended or we're not getting enough care. We often get upset when our insurance company tells us we can't have things, or maybe our employer tells us we can't have things. So the best solution in my mind is where those decisions are made between me and my doctor, and that is what consumer-driven healthcare is all about.
There is a revolution going on in healthcare today. It's been going on for the past six or 7 years, and it involves changing healthcare financing to empower patients to make their own decisions. It's doing extremely well in the market, and the evidence is irrefutable. Kaiser Family Foundation found last year that the average family HMO premium was $13,100. The average premium for HSA coverage was $9,100, a savings of $4,000 per family. We know that it's lowering trend. You know, the administration and Congress keeps saying, well, how are we going to bend the cost curve? We know how to bend the cost curve. Consumer-driven plans are rising from year to year at a rate of half of HMOs and PPOs. It is allowing people to save for their future needs. A consumer-driven market report, which is an industry publication, found that $9.2 billion are held in bank accounts for health savings accounts. People don't have restrictions on who they can see. As long as it's a recognized service by the IRS under 213D, they are allowed to go to any provider or get any treatment that they choose. So they can go to a nurse midwife, they can go to an acupuncturist, they can go to a chiropractor. They don't have an insurance company saying this is okay, that's not okay. They get to make their own choice. It is good for information services, wellness programs, and preventions. We have solid evidence that participation in all of those services grows dramatically when people are controlling their own funds. And then finally, because of all this, there is a sizzling growth in market share. The Mercer found the per employee premium for a PPO was $7,400 in 2007, for an HMO $71, for an HSA $5,700. Dramatic savings in premium cost. Mercer in 2008 found that the average PPO deductible had gone in 1 year from $500 to $1,000. This is the approach that is taking over the market. But even with that, it found that a PPO with a $1,000 deductible cost $7,800 in premiums per employee. A consumer-driven plan, which included an HSA or an HRA, only cost $6,200 per employee. So it's not just the high deductible. High deductibles are a start, they're a step in the right direction, but when they're accompanied with a savings account, all of a sudden that consumerism clicks in and it becomes a much more dynamic program. There are things about the healthcare system that consumers should be dissatisfied about. And to the extent that this is exposing them to the realities of healthcare, there is a lot to be unhappy about. It is bureaucratic, it is inefficient, it is unaccountable, there's no question about it. And you can overlook that stuff if you just pay $10 to see a doctor or $25 to go to the emergency room. To start paying your own bills, you start looking at these inefficiencies and you start looking at this lack of accountability. This is what's going to drive change in healthcare delivery. Dissatisfied consumers. We've tried putting the power in the hands of insurance companies and employers and the government. None of it has worked. The only thing we haven't tried until now is putting that power in the hands of consumers. And consumers will make that change happen. They will bring about the revolution.